My name is Madhin Sahayo. I'm the UNAIDS country director in Kenya. And UNAIDS, as part of the UN system in Kenya, we partner with government and people of Kenya to implement basically the Sustainable Development Goal, as you know, the development framework that all member states adopted in 2015. And as UNAIDS, we specifically focus on the HIV response globally and also at country level. So that happens basically by generating data, what is happening, how many people are infected, how many are accessing treatment, and the related things.
How has the response been so far with COVID-19? Has it had any effect on your activities?
So as we all know, COVID came completely unexpectedly, and as you know, it has affected the whole world. There is no exception. So obviously, one of the main challenge with COVID has been that people were getting infected at an alarming rate. In fact, if we see, the global trend as of yesterday, it has been more than about 15 million. And Kenya is not an exception, although the numbers are much, much less compared to the Western world. So when COVID came, it has, as I said, affected people. Even the death rate has been very high. The socioeconomic activities been highly affected. And there has been a disruption in supply chain and a number of even overwhelming the health system, as you know. When it comes to people living with HIV, of course, as part of the general population, they are equally affected, if not more, depending on whether people are adhering to their treatment services or not. If we look at the statistics in Kenya, we have an estimated number of 1.5 million people living with HIV. And of this, about 1.1 million people are already accessing life-saving treatment, which means the viral load is suppressed in those who are on treatment. But we have a gap of around 400,000 who do not know their HIV status, or probably they know, but they have not been put on treatment, which means the viral load in their body is high, that will expose them to COVID, which will be now, a double effect. As you know, the COVID effect is also affecting the respiratory system, and a number of other health challenges. So that definitely, affects people living with HIV. So it's very important that people adhere to their treatment services so that they cannot be affected more or being exposed to COVID as well. That is one. Also, because of the restriction of movement, as I said, because one of the directive that all of us have to observe as guided by Ministry of Health and globally by WHO is basically, stay at home for some time. So that has obviously affected the economy. And if people living with HIV, because some are also co-infected with tuberculosis, that again compromises their immune system, and it's very essential and important that they have access to nutrition commodities as well. But because of the economy activity, again, people living with HIV are now become more vulnerable, and if they don't have access to nutritional commodity, that also poses more challenge on people living with HIV. And also during COVID, as you know, we have been hearing, in fact, there are statistics that there is a rising on gender-based violence. And imagine what that means. It is automatical that, more people will get infected with HIV, right? So that is one. Also the teenage pregnancy, because we know schools are closed, so children are staying at home. So that has also unfortunately caused an increased teenage pregnancy, which means there is no protection And yes, with the pregnancy, but there is also, HIV infection. So it's really a very compounded challenge that people are facing globally, but even in Kenya. So COVID has really been a serious challenge, but thanks to the government, there was a proactive preparedness to at least contain. That's why we are not really seeing like exponential kind of spread of the virus in Kenya.
Globally, there's 15 million infections. What does that mean for treatments like ARV and PrEP? Are we experiencing a shortage in that as well?
Most of the ARV drugs, the generic ones, they come from India.
Yes.
And in fact, about 80%, by the way. So India has also been one of the countries that has been affected highly by COVID. And there has been an extended lockdown period, which means the manufacturing sector is also highly affected as people are staying at home. So that definitely creates a kind of competition to supply the countries with the needed HIV commodities. And of course, because of the COVID, again, many of the manufacturing factories have repurposed their production line to cope with the needs on PPE and other commodities that are essentially needed for the prevention and containment of COVID. So these two coming together, and also the ban on international flights generally globally, even if commodities are available, they need to be transported. So all these have been a factor in kind of creating a risk whether countries have enough stock to ensure that people have access to ARV and other HIV commodities. Fortunately, in Kenya, there hasn't been a very serious challenge. And now that countries are also opening up, now it's a matter of strictly following up so that the commodities can be delivered and there won't be a disruption of services. Because if there is disruption of service, then it can really cause a challenge in terms of the morbidity, mortality. In fact, there was a mathematical model done by UNAIDS and WHO, and they estimated that if there was a disruption of services for about 6 months, then we would find ourselves back to where we were in 2010, which means more than 500,000 deaths would be caused by the disruption of services. So it's very, very crucial that we ensure that people continue to access their medication.
With all that in mind, what is you as UNAIDS doing, especially in Kenya, to help these people living with HIV and AIDS?
So when COVID hit the country, the first thing that we did was based on lessons learned again elsewhere, like including in China, because as we all know, COVID started in China. So what have they done to ensure that we don't get into the challenges that I just mentioned? First of all, it's information and communication. I think this has also been one critical intervention that the government took and implemented. So as UN, including UNAIDS, we have collaborated with the government, as part of the communication, the task force under the COVID National Emergency Task Force, to ensure that people get correct and timely information on how to prevent, from getting infected. And also if one gets infected, then what are the subsequent action? Because we have had the guidance from WHO and the Ministry of Health. So that was one that we did. Then secondly, because things have changed, the health system was also overwhelmed. It was very important as UN collectively to also collaborate with government to ensure that we have all the necessary preparation in case a number of people get infected, so that they can be assisted with treatment, as the quarantine, the isolation, the testing, and all of that. So that was also done. And then as part of the UN collective action on our partnership framework, we have repurposed the resources that we had because things have changed. Obviously, we were not in a position to continue as it was planned. So it was very important to repurpose the resources that we had, but also the critical interventions that are required now to respond to the COVID pandemic. So through that, we collaborated, as I said, it's a multi-sectoral approach with different government institutions, but also with civil societies. As I said earlier, because of the lockdown, even the social, the livelihood has been completely affected. So how can we provide social protection to the most vulnerable, of course, including people living with HIV, pregnant mothers, adolescents, children. So we have done that. Also, the other intervention that was introduced by government was keeping hygiene. So they also need to have access to hygiene materials. So as UN, and specifically UNAIDS, we have collaborated with private sector, and we distributed more than 10,000 hygiene packs to the people living HIV. They are very broad: women living with HIV, adolescent, key population, children, and others. So those are some of the things that we did. But in addition to this, what is very important is also to collaborate with government to make sure that people have access to a multi-month dispensation of ARV drug, which means people should not necessarily go every day or every month to hospital, because that will also, first of all, it will congest the facility, competing with the other needs, but also there is no need as long as they are stable patients, so that they are given at least a 3 months, ARV stock, and they can take it, from home. As long as they are okay, they don't need to go to the facility. So that was also done by NASCOP, the Ministry of Health. So this was really one great move to ensure that, yes, people are complying and adhering to their treatment services, and they continue to suppress the viral load in their body. So these are some of the activities that we have done in collaboration. As I said, it's a UN collective, but there are activities that we also do.
And just keeping on the preventive measures that has been advised on COVID-19, how else can they keep themselves safe?
So people living with HIV as part of the general population, as I said, government has been proactive in introducing a guideline on how people can prevent the spread of the virus, because that's the most effective way. Prevention is better than cure, obviously, but we might not be able to prevent 100%. So obviously that's why we have, about 13,000 people who have contracted COVID. So one of the directives that the ministry introduced is, one, wearing and properly a mask, so that they can prevent. That is number one. The hygiene, the washing hands and sanitizing, our surrounding is also another directive. Of course, we have seen a number of directives or guidelines introduced by the government, including how people move, even using public transport and all of that. So I think it's very important to observe what the Ministry of Health has introduced as a guideline that applies for everyone, not only for PLHIV. But then secondly, as you rightly said, yes, people cannot just stay at home. I think that's why even government allocated the 1.1 billion, the 1 billion shilling to support, most vulnerable population, so that they can stay at home until now the country feels okay, we have stabilized and we are towards containing the virus. I think that has been a very critical intervention. And even as UN, as I said, we have repurposed the resources that, the budget that was available for the development plan to make sure that the most vulnerable population have access to social protection. That's very, very crucial. Again, what makes PLHIV more vulnerable, as I said, is because they are more, especially those who are not on treatment, because the viral load is high, they are not taking, meaning they are immune compromised basically. So they really need to know, their status. And if one test is positive, it's very important and critical that they are put on treatment. I think that is one. especially for people who living with HIV, but also the adherence. So the 3 months, multi-month dispensation, as I said, that the ministry, specifically NASCOP, has issued a guidance that is also very critical. So as long as they observe the guidelines that have been provided or issued by government, but also making sure that they adhere to their treatment service, they can remain safe. But the economic activity, yes, it's a challenge. The socio-economic recovery plan, the UN is also working with government. How can we expedite, the activities so that people can indeed reactivate or, get into getting their livelihood? I think that remains a challenge, but I believe the process has started. So hopefully that will also be resolved step by step, slowly. So in a way, it's very good that we know that mass is happening, and at some point, with all the interventions that are being taken, the country should be able to now flatten the curve. But again, we need to make sure that this is not, a government responsibility alone, but all of us, in fact, individuals, starting from me, I have to make sure that I observe all the intervention issued in the guideline, also at family level, at community level. And that's how, this pandemic can only be fought if we really work in solidarity, hand in hand. So it's not we wait for people to be infected and then we prepare hospitals, ICU, and so on, because it would just overwhelm the health system. So it's very crucial that we work hand in hand. I know the numbers are kind of, rising, but with the interventions and with the support of all partners working together, we should be able to flatten. I know the projections are showing Kenya is yet to see the peak. We don't know when that is coming, to be honest, because again, it's proportional how we are working together, how we strengthening the prevention measures, but it has to be flattened. I think it's not really an option, because otherwise the economy will just die.
Thank you so much, Madam. Maybe you can give us your last sentiment.
Yeah, thank you so much for the opportunity. And my last comment is, again, COVID is one pandemic. I know in Kenya we have other issues, threats, like we have seen the flooding that has really affected thousands of families. We also know that the locust invasion, especially in East Africa region, that is also another threat. So how can we have the real multi-sectoral approach and that solidarity to fight these multiple threats that will affect the population, that will affect food security, and that will affect our economy as well. So this is the time where we really need to come together, including the private sector for that matter. So as I said, it's not a government responsibility alone, but all of us, communities, government. So it's a whole society approach, and we need to accelerate our intervention, because this is not something that, okay, let me deal with this one and then the other one, because they are very much integrated. So hopefully, we'll overcome these multiple threats that we are experiencing, and we get into back maybe the new normal, not the old normal, but new normal.